If there's one word that I could use to describe CureSight in my practice, I would say exciting. I'm Dr. John DeVaro. I'm the pediatric ophthalmologist here in Savannah, Georgia. I've been practicing here since 1997. We opened the Children's Eye Institute of Savannah in 2009. We have a very busy practice. CureSight is an incredibly useful adjunct in the treatment of amblyopia in children. For those of you who have had a child who has undergone patching, for those of you who have had a child who has undergone dilating drops trying to deal with school, to suddenly have a situation where you can offer something much more technologically savvy, it's exciting. The treatment of amblyopia has been standardized for years. We have a significant amount of challenges when we're using the standard patches and eye drops, atropine eye drops in kids with amblyopia. Kids don't want to patch. And it's not just the social and the psychological impacts of patching. Anyone who's tried to put a patch on their face, you've got the mashing down on the eyelashes, you've got the ripping off of the eyebrow at the end of the day, but it was our standard. Now with the dioptic therapies, we have a completely new approach, and it's kind of reinvigorated me in my practice. I will tell parents immediately on presentation, we can do one of these standard care treatment methods, or we can do something that's new and exciting. I've had people come back who have been patched and now they're improving on CureSight, and they say, this is so much better than patching. What I liked about CureSight was how easy it is for the practitioner to bring it into the practice. They ship the computer to the family with their little blue-red glasses. They teach the family how to use it. Of course, kids are much better adapted to computers than we are anyway, and most of the kids, after a brief training, are doing it better than the parents. I think the main difference between CureSight and other therapies, one is it's much less boring, because the content is infinite, and the other main difference is the maintenance of using the peripheral vision of both eyes while you're using the device. And I think that will enhance stereopsis and enhance depth perception in the child while it improves their central visual acuity. With CureSight, there's much better compliance. There's much better interest in the part of the kids. You know, it's a digital patch, as I like to tell my parents. Wherever the child is looking, that's where the patch is, in front of the sound eye. There have been some studies that Novasight has looked at where compliance across the country has been better than 90%, and that is not the case with patching. I would tell any eye care provider this is something that brings modern technology into your practice, and besides the success you'll get with the children, I think you'll feel gratified that you've brought it in to your community. I think what's fascinating about walking into a room with a child that's been doing CureSight is the comments that come from the parents, like, thank you so much for what you've just done for my child. That makes your day. It's not usually something you expect to hear in an amblyopia treatment situation like you do in our CureSight patients.